All right, so I'm Michael. I'm one of the co-directors for the UBC Fraser Health Fellowship. Myself and Claudine are the two co-directors. And we're last but not least, but we'll give you some of the highlights of our program. It's a 1-year program, and you get to live in Vancouver. So, any questions? Kidding. So, I should probably talk a bit more, right? So, here's our team. So we have Claudine Storms Bliss. She did her fellowship in Vancouver to get all the chronic pain sort of stuff that Caroline is just talking about. And myself and Mina Wisa, we did our fellowships in Ottawa. Justin Bowie, Cornell Smith did their training in Regina with John Teal and team. So you see it's across Canada. So it's a pretty diverse training. Now we're looking at Vancouver. So I know Vancouver is great, but I need to learn surgery too. Oh, but you will. So surgical exposure, my cat's going crazy, get out of here. We're talking 3 to 4, sometimes 5 days a week in the OR. Everything else everyone's talking about, right? Like fibroids, endo, adeno, infertility, talking laparoscopic stuff, hysterectomy, myomectomy, deep infiltrating endo, all these things. We got hysteroscopy. I'm talking main OR, outpatient procedural sedation as well, myomectomy and septoplasty. And there's one more category here, but there we go. Placenta accreta spectrum. So thankfully, my home hospital is BC's accreta referral center with a central intake clinic. The fellow attends almost all the cases. And there's Evan, our current fellow. I think that's October 1st or something around there, but he's doing his half of accreta already, getting his own intra-iliac vessels. So there is a lot of exposure. We're talking preoperative surgical planning, doing our cysto and stents ourselves, ligation internal iliacs. And we have a really good way. We have interdisciplinary rounds with maternal fetal medicine, radiology, OB-GYN, anesthesia, and pathology. So great. All I want to do is cut, but you gotta know when to operate. And I promise you won't get slapped. I'm also not Batman. We have well-rounded fellowship, I think. It's 1 to 2 days a week in the clinic. We're talking chronic pelvic pain, fellows clinics, some of our own sort of community clinics as well. Half a day to 1 day per week, doing research, academia kind of things. You'll become a great surgeon teacher, I think. You're teaching the residents and medical students in mainly the OR, but also anatomy and simulation labs. You also have moonlighting opportunities where you get to maintain some of your general OB-GYN skills and you get to keep all that fee-for-service billing, which is really important because you don't need to do this, but don't look up Vancouver real estate or renting prices. Just come to Vancouver, don't worry about it. So what makes us special? Well, we're a team of, I think, young, extremely motivated fellowship directors. We have faculty with diverse MIS training background across Canada. We only take one fellow a year, and we always prioritize learning for the fellow. You're gonna have complex procedures to learn from. You're gonna have simpler cases to practice on and practice your autonomy, where we're gonna be hands-off. There is a clinic time to learn who to operate on. You'll have academic time to show candidates just how great you are. Oh, and did I mention Vancouver? So this is the view from Squamish to Chief. You can hike here. I personally hate hiking, but I will take, guests and out-of-town people hiking once or twice a year up to here. It's a beautiful view. There's lakes here. This is the view from Dr. Sorensen's Bliss lakefront property. Yeah, she fancy peoples. Here's an outdoor concert in Whistler. The Stars, my favorite band, great concert. And yes, we take our fellows skiing because that's how fun we are. So come join us in the breakout room. And those are emails. And of course, happy to answer questions.